Marie Claire Opgo, your student midwife for today. So today I'm going to perform a history taking and a vital sign to our pregnant woman. So history taking is an important aspect of successful midwife and patient interaction. Gathering information from your patient medical history is needed for effective plan to promote health awareness and guide your patient accurately from the possible risk during her pregnancy. So, in communicating or assessing history taking to your patient, it's important to remember to show respect and support, to be a trusted person without judging your patient. So first is prepare the environment. Make sure that you provide patient privacy. Then prepare your client, let her rest to a comfortable position. Then get the equipment needed for history taking and a vital sign, which I already have here. Paper and pen for the documentation. Then I already have here a sphygmomanometer and a stethoscope for blood pressure taking, thermometer for temperature, a cotton balls and then alcohol, then a watch with a second hand for respiration rate and pulse rate. So, start by identifying your patient and explaining to them of what we are going to do today. So, hello, I'm Marie Claire Opgo, your student midwife for today. May I know, mom, your name? So, Miss Whitbear, today I'm going to ask you some personal questions and take your vital sign. Don't worry, you can trust me. I will support and guide you until the end. Is that okay for you? So, may I know your full name? Okay. Your occupation, ma'am? Your age for now? Your date of birth? Do you have a husband? Are you single or married? What's your husband's name? What is his occupation? Is this your first time having a baby or do you have a child before? What contraceptive methods do you take currently? Are you having a pill or injection? Okay. So when is your first menstruation or menarche? Okay. The age of 15. Okay. Your last menstrual period before you got pregnant, do you remember? Okay. How many days your period occur? It's in a week? 5 days? 7 days? How heavy is the flow? Do you have a regular menstruation? Monthly? Or irregular? Okay. If you don't mind, may I know if you're a smoker or do you smoke? How many sticks that you have a date? Okay. Do you drink alcohol? How often do you drink alcohol, man? Okay. Do you have an abortion before? Okay, no. Do you have any allergies from medication or foods? Anything that make you allergies? Okay, no. May I know if you undergone any operation like cesarean section? Okay. Do you have past injuries or illness? Like heart disease, hypertension, diabetes? No. UTI or urinary tract infection? Do you have a hereditary disease from your parents or from the parents of your partner? Like asthma? Heart disease? No. Hypertension? HIV? So for now, for the past days, do you experience nausea or vomiting? How often do you vomit for a day? Do you feel any discomfort or feeling fatigue? Okay. So for now, do you take any medications? Like vitamins? Okay. After asking some questions, evaluate the estimated date of confinement and the age of gestation using Nichols rule. So now, I will be getting her vital signs, which is vital signs is an essential care to the patient where we monitor their medical problems by taking a blood pressure, respiration rate, pulse rate, and their temperature. So since we already identify our client, we are now explaining to them the procedure and assessing your physical condition of your client. Make sure that they rest before we get their blood pressure. So, Mr. Bear, I'm going to take your blood pressure for now. I will assemble my equipment here. Is that okay for you? Then, wash hands or sanitize your hands using an antiseptic solution. So now, place your client in a comfortable position where I place my client in a supine lying position with the arm at the level of the heart and the palm facing up. So preferably in taking a blood pressure, we use left arm because it is near the heart, but in this demo, I will only use the right hand. So now, place the cuff of the arm. So now, wrap the cuff at the arm of the patient. When it become roll the clothes like that to cuff at the arm of the patient. Feel the pulse at the brachial artery using our fingertips. Like this. So now wear the stethoscope to the air. So air. It's really hard for me to move since we don't have a real patient. Then, before we pump the air, make sure that the bulb is turned off clockwise. It should be closed. Then, deflate. Until you hear the sound. Okay, release. Okay, 120 over 100. I just want to repeat it. Close. Deflate. So, after that, roll the cuff and place it in a proper place or in a bag. Then, clean the airpiece of an stethoscope using a cotton with antiseptic solution. Here. And place it in a proper place. After that, wash our hands or use an antiseptic alcohol. Then, document the result of blood pressure taking. So, next is getting her respiratory rate. So, it is an act of breathing where we intake oxygen and outtake carbon dioxide. So, first is wash your hands or use an antiseptic solution. Then, identify your client and explain to them the procedure. After that, hold the breast of the client as you were taking her a pulse. Then, observe the client's rise and fall of the chest as they breathe. Using our watch with second hand, count the breath and one full minute. After that, record the number of respiration. So the normal rate of respiration is 16 to 20 breaths per full minute. So now we will take our patient pulse rate using our watch with a second hand and one full minute. So first is wash our hands or use an antiseptic solution for the transfer of microorganisms. Identify your client, explain to them the procedure, and now have your patient rest his arm along the side with an extended palm like this. accurate result. So, after that, as a healthcare provider, wash your hands for infection control, then record the pulse rate, including the rhythm and the pulse immediately. So now we will be taking her temperature. So first is identify your patient, gather all the equipment, which is, I've already here our thermometer, then explain to them the procedure, wash your hands for infection control, provide patient privacy. In taking temperatures, there's a many way. It can be oral or using here at the arm, at the armpit, under the armpit. So now move the clothing or the gown of the patient. I will demonstrate myself here. Then wipe the thermometer, globe and steam here.